Hi, this is Dr. Lee again. This time I would like to discuss something about blood sugar. I came across a question that one of my church friends asked me why her mother's doctor telling her mother is not diabetic when her mother's blood sugar is 126. The reason being why because we don't just go by one number or one readings. Uh, Before we diagnose a patient diabetic, we actually do more studies. For instance, we will check the patient's random sugar, which including the fasting blood sugar. For fasting blood sugar, the person had to be fasting for at least 8 hours, which means nothing to eat, nothing to drink for 8 hours before the blood sugar being checked. Um, if the fasting blood sugar less than 100, and it will be considered normal. But when the fasting blood sugar between 101 to 125, with the unit milligram per deciliter, it will be considered impaired glucose tolerance, or you could say pre-diabetic. But when the blood sugar or fasting blood sugar is persistently more than 126 for 2 occasions, and then it will be considered diabetic. Um, Unfortunately, those random sugar or fasting blood sugar is being affected by the meals the person eat the night before. So for instance, if you have a big meal the night before or you eat too much the night before, and the next morning fasting blood sugar will be higher, which is not necessarily mean you're diabetic. That's why we need two readings. Or on the other way, if you don't eat at all the night before or you didn't have any dinner or lunch, then the next day fasting blood sugar will be much lower or even below the normal level, but which is not necessarily mean you're not diabetic. So most of the time we go further. For physicians, we would like to order something called hemoglobin A1C test. Hemoglobin A1C test is a test by blood. It will tell us the average blood sugar level in the person for the previous 3 months. So it's not affecting by the meals the person eat the night before, and the patient actually does not need to be fasting for this hemoglobin A1C test. We used this hemoglobin A1C test as a diagnostic test for diabetic, and also to use it as monitoring the therapy to adjust the treatment dosing for diabetic. The cutoff value of the hemoglobin A1C is 6.5%. Because at this level, the risk for the diabetic retinopathy or the eye problem caused by diabetic is substantially increased at this level. For the hemoglobin A1C level, 5.7 to 6.4%, which is considered pre-diabetic, and for level less than 5.7, which will be normal. Again, we don't only go by one hemoglobin A1C level. Most of the time, we try to get two readings at different times, at least 4 weeks apart. But for someone who is symptomatic with persistent blood sugar more than 200 for more than 2 occasions, even one hemoglobin A1C reading more than 6.5%, we still diagnose them as diabetic. So, what symptoms we are talking about? For early symptom of diabetic, you're talking about frequent urination and also increasing thirsty. You always want to drink water even though you're not working outside or not sweating. And also patient will have a nocturia, which means you will get up frequently at night time. You're talking about more than 4 or 5 times, even you don't drink any water before you go to bed. So for those symptoms occurring, basically it's directing to a diagnosis of a diabetic, and then we will check the fasting blood sugar and hemoglobin A1C level. Um, so this might explain why for my friend's mother, she even though has a blood sugar 126, is not considered diabetic at one point because that's only one reading, and most likely she had to return to the doctor for another blood check, and most likely she will go for hemoglobin A1C level before a diagnosis of diabetic being made. So if you want to know more about diabetic, I will go over it later on. And at this point, let me go over the simple symptom again. For diabetic, mostly patient will suffer from urinating a lot and also getting up to the bathroom more often at night time, even though they're not drinking water or food before they go to bed, and also they will be always thirsty and looking for water to drink. And those actually are the basic symptoms for diabetic. And I hope you enjoyed this discussion. We will see you next time.